Tim Bennett here from the Cortland Voice, and I'm here with Dr. Saada from Cayuga Health. Doctor, how are you today?
I'm doing great, Tim. Thank you for having me.
Beautiful. Today in this segment, we're going to speak on neurology, and but before we get into that, as everyone knows who's been watching these segments over the years, we love to learn about who we're interviewing. So, Doctor, tell us about yourself.
Yeah, sure, Tim. So I am a neurologist here in the Cortland area. Started July of 2023. This is just a few months ago. It's been a great start so far. I trained at the University of Florida down south in Jacksonville and Gainesville. And I did a fellowship training at the University of Rochester doing clinical neurophysiology. I enjoy running, and during my time off when I'm not seeing patients is running, exercising, and spending time with a family. I've got three beautiful children that I like to do some sporting events and just participate with sports with them and so forth. So overall, we have opened our clinic here in Cortland, and we are seeing all neurological conditions from stroke, seizures, migraines, multiple sclerosis, Parkinson's disease, and many more. So I'm happy to be here.
Beautiful. Now, just to break it down, what I mean, I know you said a few of the things that you see, but what is break down the field of neurology just to someone who doesn't know what that means?
Neurology is that's a great question, by the way, Tim, because we get confused between neurology and neurosurgery. So, neurology is the study of the brain, the spinal cord, and the peripheral nervous system. So, anything outside the spinal cord, your nerves in the hands, your muscles, and so forth. So, patients that suffer from, for instance, headaches, or patients that have abnormalities in the brain or in the spinal cord, we are the physicians that make mostly diagnostic workup and get a diagnosis in order to help the patient get the certain studies or get the certain intervention that could help them with their neurological diagnosis.
Understood. So tell me this, because you mentioned it before, and this is a popular term. What is a stroke, and like how can we recognize the signs?
Yeah, a stroke, I explain it to our patients. A stroke is like a heart attack, but it's occurring in the brain. So it is it's a medical condition that disrupts the blood flow or blood supply to part of the brain, and it reduces that blood supply. So what that means is you're not getting enough oxygenation into parts of the brain because of the blockage of the blood vessels. There are different types of strokes. There is the ischemic stroke, where it's an actual blood vessel that's closed, or a hemorrhagic stroke, meaning there is bleeding in the brain due to a ruptured blood supply inside the brain.
Understood. And why is it crucial for everyone to learn about, um, you know, sh- uh, stroke prevention or learning about the different things of a stroke?
Yeah, so the most
Symptoms.
important thing I would say is to learn how to detect a stroke, because recognizing the warning signs of a stroke can be the most important thing to do, because it can save a person from having long-term neurological problems. They teach this in middle school nowadays, where you have to know the acronym FAST, right? If you see someone having an uneven smile or a facial droop, that's for the F. If for the A, if someone has a weakness on one arm, it's dropping. And for the S is the speech, is a patient having slurred speech or difficulty swallowing. And as part of the acronym of FAST, the T portion is you have to call 911 immediately, because if you find any of these signs, a patient's having, or someone in front of you is having a stroke, and they need to get to the emergency room immediately.
Okay. Now, does age play a risk?
Yeah, so age and stroke risk is definitely a combination that we see here. So as people age, we know that arteries can harden or get clogged. So that could increase the risk of stroke. So really, it's really important that when we get older, we are optimizing our risk factors that can cause a stroke, because there is an association. Yeah, there's an increase in risk of stroke, especially after the age of 55.
And what can those, as they're approaching 55 and those beyond 55, do?
So regular medical checkups is important. Keeping mentally and physically active, and taking prescribed medications or other interventions that help mitigate the risks associated with aging and associated with other medical conditions. We're talking about things like high blood pressure, making sure a patient avoids having high blood pressure, or if they do have high blood pressure, making sure it's under control. High cholesterol, either avoiding it, or if they do have it, figure out ways to prevent the cholesterol from causing a plaque by taking the right medication. Diabetes, making sure the diabetes is under well controlled.
Okay. Now, nutrition. I love to eat. Many love to eat. Does nutrition play a role in prevention for the prevention of having a stroke?
That's right. That's right. High fatty foods, which we love, are French fries and burgers, right? Those can increase your risk of having a stroke. So foods and diets are important ways to prevent a stroke in the future. So foods with high rich foods of antioxidant foods, such as berries, nuts, dark chocolate, spinach, and all these vegetables are actually good for you to prevent your arteries from hardening. Other foods to adapt and consider to reduce the risk of stroke are a high fiber foods, so oats, beans, lentils, and other Mediterranean type of diet to establish. And the most important, I think, also is making sure you stay well hydrated. So adequate water intake is extremely vital, because dehydration can thicken the blood and as a result can cause an increased risk for stroke.
That makes sense. And for any other questions on nutrition, you also have nutritionists at Cayuga Health. So Cayuga Health, I feel like it's like a Walmart or Wegmans. You name it, you have it all over there. But what exercises can someone add if they wanted to? Because you say stay fit, stay active. What can you add to your daily routine that might help with stroke prevention?
So incorporating exercises that really focus on balance, strengthening, and endurance, such as, for instance, like Tai Chi or Pilates, can be especially beneficial in improving your cardiovascular output. Other exercises that I recommend, mostly because some of our stroke patients are in the elderly age, so it's hard for them to do certain exercises. So just walking around and staying active, doing some activities for at least 120 minutes a week. So about 15, 20 minutes, about 20 minutes a day of just walking, fast walking, and stationary bicycling. These exercises, you don't need a lot of equipment, and it could be enjoyable. Don't have to be strenuous, but just moving around and not staying stationary in one place can help reduce the risk of stroke.
And that could even be done with your dog or your animal, taking your animal for a walk, something like that, or playing outside with them. So I get what you're saying on that. Does smoking play a risk, whether that be cigarettes, vaping, marijuana?
Yeah, and they all increase the risk, actually. So nicotine and carbon monoxide in cigarette smoke damages what we call the cardiovascular and the cerebrovascular system, so the blood vessels itself. Smoking has been associated with increasing the risk of stroke for decades. And we encourage our patients, this is the first thing to do. We can give you all the medication to try to prevent a stroke, but as long as you continue to smoke, you're still at a higher risk. And there are many quitting strategies that patients can ask for through their primary care. There are behavioral therapies, medications, there are patches, but without actually reaching out and trying to quit and trying to get assistance to quit, it would be extremely hard to just stop cold turkey. So supportive care and making sure you reach out to your primary care doctor to help with the process is the way to go.
Okay. So families and loved ones and others, they how would you what would you advise them to do to support someone that um that that has experienced strokes and you're trying to help them with prevention? Like, is there, I mean, I know with different things, there's classes and family therapy and different programs, whether walks or does your office offer different things for awareness? I know you'll meet with the clients, but like what services are out there?
Yeah. So after really for family support of a loved one who is suffering a stroke or who has already suffered a stroke, there are two approaches here. If anyone is actually having a stroke in front of you, the best thing to do is, of course, call 911 to get them to the emergency room. Most of the time, it would be too late if you try to drive the person to the ER, because sometimes these ERs are flooded with patients and the urgency is not there when you're just walking in compared to coming in through the ambulance. For someone after having a stroke, ensuring that your loved one is safe and supported and comfortable after the stroke, meaning making sure they can get to the bathroom with assistance, making sure they don't fall, and avoiding certain foods and medication if they have trouble swallowing. And then in terms of the rehabilitation process, we usually recommend, if depending on the stroke severity, we usually recommend patients to undergo rehab in an inpatient setting and then transitioning to an outpatient rehabilitation. There we have occupational therapists, physical therapists, speech pathologists that help with the whole process of recovery for up to 6-8 weeks, 3 months, as long as it takes to support the patient and their loved one.
Beautiful. Are there is there a final word that you would like to give to the community?
Absolutely. And first is the most important takeaway message, I would say, is be proactive in your health and lifestyle. Stroke can be prevented in 85% of the time if we can control the risk factors that we talked about. If someone's having a stroke, it is extremely important to come in right away. So a little bit of numbness on one side of the body, acute onset, meaning if it started suddenly, that is an emergency and it needs to be evaluated immediately, because our treatment for stroke is really prevented. It's limited if we don't treat the patient within a certain hour. After 24 hours of symptoms, it's really hard to offer patients acute management, right away management in the ER. And then things like blood thinners and cholesterol medication would be the main treatment. So stay informed, be an advocate for stroke prevention within our community here. And we are available for any questions. If a patient did suffer a stroke and needs to establish care with a neurologist for follow-up, we would be more than happy to assist in the rehabilitation process that takes place.
Perfect. Doctor, thank you for joining me and educating the greater Cortland community. And for everyone watching, thank you for choosing the Cortland Voice. Thank you. God bless.
Thank you, Timothy.